In Washington, a massive political storm is brewing. At the heart of it lies a sweeping Republican-backed megabill that promises tax cuts, spending changes, and economic growth. But according to a bombshell analysis from the nonpartisan Congressional Budget Office, there's more beneath the surface. While the wealthiest Americans stand to gain, millions of low-income families could face devastating losses, including food insecurity and cuts to healthcare. In this video, we'll break down exactly what's in the GOP Megabill, what the CBO says it means for the rich and the poor, and how this political battle could shape the future of economic policy in America. The Republican megabill currently making its way through the House is a sweeping package of tax policy reforms, spending cuts, and regulatory changes. House Ways and Means Committee Chairman Jason Smith says the bill is designed to unleash economic growth and prevent future tax hikes for middle-class Americans. But here's what the bill actually does: trillions in tax cuts. These are heavily tilted toward the wealthiest Americans and corporations. The top 10% of earners would see substantial reductions in what they owe the federal government. Targeted tax hikes. A few provisions are designed to help offset the cost of the tax breaks, but critics say they don't come close to covering the massive revenue loss. Major cuts to social safety nets. The bill slashes federal spending on Medicaid and SNAP, the Supplemental Nutrition Assistance Program, also known as food stamps. It introduces work requirements for Medicaid, a move expected to push millions off their healthcare coverage. State burdens. With federal funding set to decline, states would have to pick up the slack or cut services, leaving millions vulnerable. The Congressional Budget Office, known for its nonpartisan economic analysis, released a preliminary report at the request of top House Democrats. The findings: alarming. Let's break it down. By 2027, the lowest income 10% of households will see their resources fall by 2% of income. By 2033, those losses climb to 4%. That's money taken away from food, rent, utilities, the very essentials of survival. Why? The CBO points directly to two things: cuts to Medicaid, cuts to SNAP food aid. At the same time, the top 10% of earners will see their household resources grow by 4% in 2027, 2% by the reason: massive tax reductions. In short, the rich get richer, while the poor are pushed further to the edge. The CBO's findings have reignited a fierce political firestorm Capitol Hill. Democrats are sounding the alarm, accusing Republicans of pushing a bill that favors the wealthy at the expense of the most vulnerable Americans. Here's what Brendan Boyle, the top Democrat on the House Budget Committee, had to say. This is what Republicans are fighting for, lining the pockets of their billionaire donors, while children go hungry and families get kicked off their healthcare. Boyle's not alone. Democratic lawmakers are portraying the bill as a deliberate attempt to dismantle decades of progress in fighting poverty and providing healthcare access. Republicans, on the other hand, argue that the bill is a necessary correction to runaway government spending. They claim Medicaid is being protected for those who need it most. Work requirements will encourage employment and independence. And overall, the bill will spark economic growth and prevent tax increases in the future. The ideological divide couldn't be more stark. Let's talk specifics. Medicaid and SNAP are two lifelines for low-income Americans. Medicaid provides health insurance to low-income families, people with disabilities, the elderly. SNAP, or food stamps, help struggling families put food on the table. As of 2024, over 41 million Americans rely on SNAP benefits. Under the GOP Megabill, new work requirements for Medicaid would mean millions could lose their health care, especially older adults and people with disabilities who may not meet the new standards. SNAP funding would be significantly reduced, leaving millions of children, seniors, and low-income workers at risk of food insecurity. The CBO estimates nearly $1 trillion in reduced federal spending of these programs over the next decade. That's $1 trillion taken from those who need it most. Now let's look at the top 10% of earners, the wealthy. These households will enjoy significant benefits under the GOP plan. Lower capital gains taxes, reductions in income tax liabilities, corporate tax breaks that often benefit wealthy shareholders, the CBO estimates. The top 10% will gain 4% in household resources. These gains are fueled almost entirely by tax cuts. It's a classic case of trickle-down economics, the theory that cutting taxes for the wealthy will spur investment and job creation, eventually benefiting everyone. But critics argue that this theory is never delivered on its promises. Instead, wealth continues to concentrate at the top, while wages for the working class stagnate. Republicans argue that the bill will spur economic growth, but at what cost? Yes, reducing corporate taxes and personal income taxes may encourage spending and investment, but the cuts to Medicaid and SNAP are likely to increase poverty, reduce access to healthcare, force states into budget crises, raise long-term healthcare and social costs. When people lose healthcare, they don't stop needing it. They just delay care until it becomes an emergency and far more expensive. When families lose food assistance, children go hungry. Nutrition, education, and future economic productivity all suffer. And when states are forced to pick up the bill, they often slash public services like education, transportation, and public safety. So while the economy may grow in raw numbers, the human toll could be devastating. As of now, House Republican leadership is pushing for a final vote on the bill as soon as Wednesday. If passed, the bill would then head to the Senate, where Democrats hold a slim majority. There, the bill faces significant hurdles and will likely be subject to major revisions or even complete rejection. Meanwhile, advocacy groups, healthcare professionals, and social justice organizations are mobilizing to stop what they call a cruel and unnecessary attack on the poor. This isn't just about policy. It's about priorities. Should we cut taxes for the wealthy, even if it means taking food and healthcare away from struggling families? Should we build a society where the most vulnerable are protected or sacrificed? The Congressional Budget Office has made one thing clear. This bill will hurt the poor and help the rich. The question now is, will lawmakers listen? Let us know your thoughts in the comments below. Don't forget to like, subscribe, and click the bell so you never miss an update. And for more resources, news, and analysis, click the link in the description. Looking for ways to stay informed and empowered? Check out the top 10 Amazon products we've curated for financial literacy, political history, and civic engagement, all linked in the video description below.